Hello and welcome. My name is Joshua Brown from the NHS Recruitment Specialist website, howtobecome.com. Over the last 20 years, we've helped millions of candidates around the world land their dream jobs. And today I'm going to help you take the next big step, getting hired as a physiotherapist or a physiotherapy assistant within the NHS. If you've got an interview lined up, whether you're a newly qualified physio, finishing your degree or your master's, or just beginning your career journey, this video will walk you through exactly what you need to prepare for to succeed. In this tutorial, we will cover the key skills and qualities that NHS trusts are looking for in physiotherapy candidates, what makes a great physio in the eyes of recruiters. We'll also look at the most common interview questions for NHS physiotherapy roles and how you should answer them to shine under pressure. Plus, we'll also cover plenty of insider tips on how to demonstrate your empathy, your clinical knowledge, your teamwork, and your professionalism, all vital when working with patients and multidisciplinary teams within the NHS. If you stay until the end, I'll also show you how you can get my full NHS interview questions and answers masterclass completely free. A powerful resource used by hundreds to help them prepare to pass their interviews at the first attempt. So get ready, let's jump straight into preparing your path to becoming an NHS physiotherapist. Here we go. Now, before we jump into the questions, it's crucial that you understand exactly what the NHS wants to see in a physiotherapist. Physiotherapy is not just a clinical role. It's a people-focused profession that transforms lives through rehabilitation, movement, and education. NHS employers will be assessing whether you can, number one, put patients first, ensuring dignity, safety, and positive outcomes. Number two, communicate effectively with patients, relatives, and the wider healthcare team. Number three, work collaboratively alongside nurses, doctors, OTs, and support staff. Number four, that you can stay calm under pressure, maintaining professionalism in busy environments. And number five, reflect and improve, so your ability to adapt based on feedback and clinical learning. Number six, how you can demonstrate compassion and empathy, especially with patients in pain or distress. And finally, number seven, live the NHS values every minute of every single shift. If you can show strong clinical reasoning plus a caring and confident approach to supporting someone's recovery, you will always stand out. That's how you can be the standout candidate at your interview. So now that you know what they're looking for, let's move on to the most common physiotherapy style NHS interview questions and how to answer them with confidence. Here we go. Question number one is, why do you want to be a physiotherapist in the NHS? So why is this question being asked? Well, the interviewers want to see that you are intrinsically motivated to help people improve the quality of their lives, that you are committed to the NHS values with long-term patient care, you're aware of the challenges, not just the rewards, and you're passionate about continuous learning and evidence-based practice. You need to demonstrate all of that in your answer. This is not just a "I like helping people" type response. It needs depth that shows professional purpose and understanding. So how do you do that? Well, use this simple three-step formula. Purpose, understanding, value. Purpose, why physiotherapy? What drives you? Understanding, show that you truly know what the NHS physios do. And value, how you will make a difference in the job role. So here is a brilliant top scoring example answer to help you using that brilliant three-step formula. Here we go. Why do you want to be a physiotherapist in the NHS? Here is a brilliant top scoring answer to help you. I want to be a physiotherapist in the NHS because I'm passionate about helping people regain independence, confidence, and quality of life. During my clinical placements, I saw firsthand the impact of physiotherapy that it has, not only on recovery, but also on a person's motivation, on their dignity and their emotional well-being. The NHS is built on values that matter to me: compassion, respect, and delivering care that is accessible to everyone. I really enjoy working in multidisciplinary teams where each profession contributes to a shared goal. I'm committed to evidence-based practice, continuous learning, and supporting patients through what is often a physically and emotionally challenging journey. I believe I can bring energy, empathy, and strong communication skills to help patients stay motivated and achieve the best outcomes possible. That's a great response because it shows personal motivation and professional awareness. It connects directly to the NHS values, and it demonstrates teamwork and patient-centered focus. Plus, it sounds like someone who wants to grow and stay in this job role for the long term. NHS Physiotherapy question number 2 is, how would you handle a patient who is in pain and refusing physiotherapy? So this question is being asked because they want to understand and assess your communication and empathy skills, your ability to motivate patients who are struggling, and your understanding of consent and patient dignity, plus your clinical reasoning and teamwork ability. So they want someone who won't push too hard, but won't give up either. So what do you do to give a brilliant response? Well, again, I've got a great formula for you. My CARE method. CARE. Check, acknowledge, reassure, engage. It stands for this. So C is for check. You check how they are feeling and listen without judgment. That's very important. A stands for acknowledge. So you acknowledge their pain and you show empathy. Again, a very important value and skill to do. R stands for reassure. So you reassure them and explain the purpose and benefits. And E stands for engage. You engage others if needed and adapt the treatment plan. This proves that you're patient-centered and collaborative. Here is a top-scoring example answer to help you using my CARE method. How would you handle a patient who is in pain and refusing physiotherapy? If a patient was in pain and refusing physiotherapy, the first thing that I would do is listen and understand why they are reluctant. I would show empathy, reassure them that their feelings are valid, and assess the level and source of their pain. I would then clearly explain how physiotherapy can support their recovery and how even small, gentle movements can prevent stiffness and long-term complications. I would offer to adapt the session, for example, by reducing intensity, changing the position, or focusing on breathing and comfort first, so that they feel more in control. If the patient continued to refuse, I would respect their decision, document the situation, and update the wider multidisciplinary team. Between sessions, I would continue building trust and confidence so they remain engaged in their own rehabilitation. That's a great answer. It shows professionalism and respect for consent. It balances encouragement with patient choice and demonstrates knowledge of MDT working. It also focuses on long-term therapeutic rapport, which is vital. Physiotherapy interview question number 3 is, describe a time when you worked as part of a team to deliver excellent care. This question is being asked because NHS employers want to see that you can communicate effectively with others, that you understand your role in a multidisciplinary team, that you can contribute to patient-centered outcomes, and that you can reflect and improve. This is where the STARR structure comes in. STARR. It's a brilliant way to answer any kind of behavioural interview question, a question where you're required to talk about your prior experiences. It stands for this. S is for situation. You start your answer off by describing what the situation was that you found yourself in. T is for task. You talk about the task that you needed to carry out. You then move on to A for action. What action did you take to achieve the task? The first R stands for result. What was the end result following your actions? Make sure it's always a positive end result. And the final R stands for reflection. This is where you tie your answer back to the NHS job role that you're applying for and the NHS values. So let me show you exactly how you can do that using this brilliant top scoring answer to that question. Describe a time when you worked as part of a team to deliver excellent care using that STARR structure. Here we go. Describe a time when you worked as part of a team to deliver excellent care. During a placement on an orthopaedic ward, we had a patient recovering from hip surgery who was anxious about mobilising after a fall at home. Our team needed to safely support her first mobilisation session and build her confidence. I worked closely with the physiotherapist and nursing staff to plan the session. I helped explain each step to the patient clearly, checked her pain levels, and used reassurance techniques to keep her calm. I also monitored her posture and provided safe physical support using a walking aid. The patient completed her first walk, which was a big milestone for her recovery. She expressed relief and pride in what she had achieved, and the physiotherapist thanked me for my communication and patient-centered approach. This experience taught me how important teamwork, encouragement, and clear communication are in rehabilitation. I will continue to apply these skills to help patients feel more confident and motivated in their recovery, which supports the NHS value of compassion and improving lives. NHS Physiotherapist interview question number 4 is, how do you handle pressure and a busy caseload as a physiotherapist or physiotherapy assistant? Now, this question is being asked because the NHS wants to know that you can stay calm and organised, that you can prioritise safety, that you can communicate with your team under pressure, and you can protect patient safety and well-being. They are checking you won't rush or compromise care. Here is the structure to use. PCS, plan, communicate, stay patient focused. So plan, you prioritise clearly. Communicate, you communicate clearly with the team, and stay patient focused and safe. PCS. Here is a brilliant answer using that structure. Here we go. How do you handle pressure and a busy caseload as a physiotherapist or physiotherapy assistant? I understand that working in the NHS can involve busy caseloads, fast-paced environments, and competing priorities. When I am under pressure, I stay calm and focus on patient safety first. I prioritise tasks based on urgency and clinical need. For example, supporting patients who need early mobilisation, discharging planning, or pain management. I use checklists and clear time planning to stay organised throughout the day. I always communicate with the wider team so we are aligned, and I'm not afraid to ask for support or clarification to ensure everything is done safely. Even on challenging days, I stay positive and focus on providing the best care I can to each patient. I believe showing resilience and teamwork in busy moments is essential for good patient outcomes. This is a great top scoring response. It shows practical prioritization skills and it highlights patient safety and teamwork. It also demonstrates a calm, responsible mindset and avoids sounding overwhelmed or unsure. So there we have it, 4 of the most common NHS physiotherapy interview questions, along with top scoring example answers that you can use to help you prepare and succeed and come up with your own brilliant responses. If you found this helpful, please write these answers down and practice saying them out loud. Confidence comes from preparation, so the more you rehearse, the stronger you'll be on the day. Now, if you want to take your preparation even further, I've put together a complete NHS interview questions and answers masterclass. It is completely free for you to sign up and join for a limited time. It includes over 40 modules, perfect for all NHS interviews, and I guarantee it will help you be the standout candidate in your physiotherapy interview. To get access, simply click that link in the top right hand corner of this video right now, or check the pinned comment below. It's the quickest way to make sure you're fully prepared and confident for your NHS physio interview. Now, before you go, please do 3 quick things for me. Number 1, please subscribe to the channel. I upload new interview videos every week. I can only help you if you are subscribed. Number 2, please do like the video. It really motivates me to create more free content for you. And number 3, don't forget to comment below and tell me which NHS trust that you are applying for and which physiotherapy role I'll apply to help you even further with even more interview tips. Thank you so much for watching. I wish you all the very best of luck with your interview. You're going to be amazing. Go and get that job. You've got this.